The purpose of this video is to assist assessors in building MDS-HC assessment skills. The assessor will demonstrate techniques that include interviewing, observation, and probing to obtain enough information to accurately code MDS-HC items. As you watch the interview, please keep in mind the intent of each item and test your knowledge by coding the items presented in the interview.
Hello, how are you today?
Doing fine, fine.
Good. My name's Elizabeth. I work with the Office of Aging. We'll do an assessment today on the different things that you do for yourself, the different things that you get help from other people with.
Okay.
Where are you from?
Well, I was born in Little Rock, Arkansas, but 23 years ago, I was living in Baton Rouge, and I was in an automobile wreck. That was 23 years ago. Mm-hmm. And I was on my way we had 5 sons, and we were taking our boys to a tennis tournament, and I was in an automobile wreck. Don't remember it happening and all, but it left me a C5-6 quadriplegic. Back in those days, rehabs were, you could stay there a long time. I was 8 or 9 months in a rehab hospital in Baton Rouge. Mm-hmm. Now they get you in and out in a matter of weeks.
Yeah.
So I had a real good rehab program, a lot of family support, wife and kids that really helped take care of me. Mm-hmm. Have learned a lot over the years, and feel like I'm pretty independent as long as I've got the help there with me. Mm-hmm. Enjoy helping other quads and paras that have been injured. Like letting them know that life's not over. There's still a good life in front of you. Mm-hmm. It's funny, my doctor always tells me, and we have a good relationship, but he said, you've way outlived your normal life expectancy, and I told him that, good family support, good programs that are available, through the state and federal government have made it possible to live a decent life. Mm-hmm.
So a lot of my assessment is tied to what I'm looking at is what happened or what is happening with you right now.
Okay.
It's sort of a snapshot in time. So a lot of the questions have a very specific time frame. So I'll kind of guide you through those different time frames.
As you watch the interview, try to identify the participant's performance in each episode completed and the participant's level of difficulty for each task.
So in the last week, today is Thursday. So from last Thursday to today, how have your meals been prepared for you?
My personal care attendant will take my order, whatever. Anyway, we'll decide what we're going to eat, and they'll go, prepare it and bring it to me. If I'm up in a wheelchair, a lot of times I like to eat like you put a pillow in my lap and then put the plate on that, and I've got an eating device that you want to feel as independent as you can. Mm-hmm. So he could feed me and all, but do you want to see the eating device?
I would love to.
Okay, let me get my personal care attendant to get it.
Okay.
This is Blake.
Hi Blake, how are you?
All right, and he has to position it onto my hand, and why don't you get a pillow and a plate and go ahead and stick there. And once it's on my hand, I can feed myself.
Okay.
And then when the meal's over, he'll take it off and remove everything. So, I can feel a little independence, because, at least I feed myself at at the rate I want and everything else. But normally what we do is just set it there and I can, feed myself.
Right.
And then when I'm through, he'll come over and clean up the mess I made where I missed my mouth or whatever.
Right.
And then he'll, take it off and, go
And
clean it up and everything.
So since today's Thursday, Wednesday, Tuesday, since Monday, is that how you've eaten?
Yeah, and I'll do it, a lot of times I skip breakfast, sometimes I don't, but every meal, has to be done that way.
Okay. While you are eating, are you being supervised?
Well, he's always around.
He's around. Okay.
And also to drink something, Blake, I'll get you to do something else. Go get, I guess, a glass with my straw. Whatever I want to drink, he will put in a glass, and I've got these straws that are kind of extended, and I'll, drink that.
Okay.
Now, I can't hold it, so he has to, like hold it up to my mouth or whatever.
Okay.
And, I'll drink that.
Okay.
Sometimes if I'm in a right position or at a desk or something, he can just set it down and I'll have a long straw.
A really
and I can pull
long.
up to it.
Mm-hmm.
But basically he has to get it all ready and do everything,
Okay.
for it, so.
Okay.
Yeah. So like,
Very good. So that's how you've drunk
Right.
during your meals.
every time. And,
Every
and throughout the
time.
day, if I get thirsty or something, he'll have
Mm-hmm.
to go get it and bring it to me.
Okay, I see. So since Monday, the active eating you've done with the setup support from Blake
Right.
for both your utensil and for your cup with the straw.
Correct.
Very good. As far as preparing the meal, have you participated in any of that process? Assembling the ingredients?
No, I mean, he has to do all that.
He does it all
I'll
for you?
tell him what, I want a salad and,
Mm-hmm.
I want this type dressing on or whatever, but he has to do all the preparation.
All the preparation and the cleanup after.
Right.
Okay, so I can say that since last Thursday to today, all of your meals and snacks have been prepared for you
Yes.
by another person. If you were to do any of that on your own, make a sandwich or cereal, how difficult would it be?
No, I couldn't even start to.
You couldn't even start
Yeah.
to. Okay. Housework, housekeeping. I know, I'm sure you're a lovely
I'm a
wife host, but tell me, how has that happened in the
I'm
last
a good
week?
directive giver. I can, pretty much all the wash, cleanup has to be done by a personal care attendant.
Okay.
And I really can't do any of that,
Okay.
other than just say, did you do something or whatever.
You'll follow up with them on the
Yeah,
task.
and I'll tag along behind him, make sure he does a good job.
Oh, well, everyone needs supervision,
Oh,
right?
Exactly.
What about tidying up after yourself? Is that done by you or is that done by another person?
Yeah, I really can't do any of that.
Okay. So, in the
at all.
last, so as far as cleaning up your environment, it's been done by another person
Yes.
in the last week. If you were to do any of it on your own, would you also have great difficulty?
Yeah.
Okay. So with the mail in the last week, last Thursday to today, have you done anything with your finances? Bills?
Other than,
Managing your money?
yeah, I mean, I can say what to do or what needs to be done.
Mm-hmm.
Now, by having a voice-activated computer, I keep a lot of records and stuff,
Mm-hmm.
on my computer. I do all the bank statements and all come on the computer so I can look them up that way. But if I'm actually going to need money, he'll have to drive me to an ATM and actually put the card in and do the number and everything else to get the money out. Or if I need to have a check written, he has to do all the filling out and all. Now I've got a little device that lets me hold a pen that I can scribble. I can't really sign that good.
Right.
But like on checks, he'll do all the filling out, and then I'll just scribble my name
You'll
on there.
sign it.
But he has to put the pen on my hand take it off and all that.
Okay. And when was the last time you wrote out a check with Blake's help?
Probably last week.
Last week?
Yeah. Most things can be done, nowadays just on the internet or, whatever.
Yeah. Yeah. What about, have you gone to the ATM since last Thursday?
Yes,
Okay, so you had help
doing all that,
with the
right.
ATM. It sounds like in the last week, in some of the activities like going to the ATM, you've had help.
Right,
And then other activities such as managing your money on the computer, you've done it on your own with
Right.
your voice activated
right.
equipment. Okay. Is there any difficulty
Well,
with that?
if, once I'm in my wheelchair,
Mm-hmm.
my desk is set up so that I can, roll up to it.
Mm-hmm.
And I've got a microphone that I speak into that instructs the computer on what to do.
Okay. So the difficulty would come in with those physical tasks like writing the check
Right,
and going to the ATM.
right.
Your medication, how do you take your medicine?
I've been real forceful in trying not to take, or taking as little medicine as I can. So about the only medicine I have are, I take vitamins and a couple of pills. I take them in the morning and then at night after my PCA is gone. So my wife gives them to me.
Okay. From last Thursday to today, how has she given them to you?
She'll put them in the top of a bottle, dump them in my mouth, and then I'll just, swallow them.
You swallow. So she puts the pill into your mouth.
Right.
And you swallow from there.
Right.
Do you have something to drink?
Yeah, just
And she
like
holds-
I did a minute ago.
She holds the cup like you showed
Right.
me. Okay. Is that how you've taken your medicine each day since
Yes.
Thursday? Okay. If you were to do that on your own, would you have difficulty?
I couldn't do it.
Okay.
And I couldn't get the pills out of the bottle.
The bottom. Okay. Yeah, opening the bottle.
Right.
The phone. In the last week, how have you used the phone?
I am fortunate to have a voice activated phone. So if I can get to the microphone, I can make phone calls and stuff or answer the phone through that. When I get put in bed at night, I have a microphone that's placed in front of me on a stand, and if the phone rings, I can instruct it to answer the phone. Or if I want to make a phone call, I can speak into the mic and dial a number.
Okay.
But I have to be set up and all. The mic's got to be right there in front of me.
Right. Have you used the phone to answer or make a call in the last week? Okay. And so you've done it with the setup assistance from another person?
Right.
Okay. Is your phone a landline or a cell phone?
It's a landline.
It's a landline, so it doesn't need to be charged.
Right.
Okay. Shopping. Has anyone gone shopping for you, or have you gone shopping since last Thursday?
I go I enjoy going shopping. My personal care attendant will get me loaded up into the car. I've got tie downs that keep me in place, and we'll go to a store and they'll push a basket and I roll around with them, and that's where we do our shopping.
Who selects the items?
I try to. No, I do.
You do?
Right.
Okay.
And then we'll come home, put them up, and
Okay.
usually pay with the debit card, and my personal care attendant has to do all that.
He does that for
Right.
you. And you've gone shopping since last Thursday? So you've done it together.
Right.
Nice. Okay. Now, to go shopping, you rode in your car, or you
Right.
rode in your van.
Right.
And how do you get in and out of the van?
Okay, my van is it's a handicap van, obviously,
Mm-hmm.
but like it's my personal care attendant will take me to it and lower the door opens and a ramp comes out, and I'll roll up the ramp and get into position, and then my personal care attendant will get me tied down safely
Mm-hmm.
and close up the door and drive me
And drive
wherever
you.
we need to go.
Do you know the route to get to the store, the doctor?
Mhm.
So that's another area where y'all are doing it together.
Right.
I see.
While watching the interview, listen for the level of assistance received from another person and the number of episodes the assistance was received in the specified look-back period.
So, do you sleep in a hospital bed?
I do.
You do? Okay. What type of equipment do you have with your bed?
Well, the hospital bed has a little thin mattress on it that blows up and goes. It's really
air
minimal,
mattress. Mhm.
but in another 2 weeks I'll be eligible to get a good mattress.
A new mattress,
right.
a new air mattress. Okay.
So then my pressure sores will start healing up better.
Yes.
After a year.
That'll be nice.
It will.
A big
But,
relief.
but it'll tilt up at night. My personal care attendant will raise my head up to where I'm comfortable and I can watch TV. Put my rails on the side of the bed,
Okay.
and I'm ready for the night.
You ready for the night? Since Monday, when you're in your bed, how have you turned, moved side to side,
Can't.
sat up?
I can't.
Can't. Okay.
So-
Have you done any of those things with help from another person?
Pretty much when I'm put in bed and they make sure I'm comfortable, there aren't any wrinkles under me or anything, and I'm in a position to where I'm sitting up and comfortable. I've got my microphone in front of me, to where I can, through the microphone, I can change TV stations and, do that. And then he hooks up my urological to a bigger bedside collection, gets all that set up. I'm that way until he gets back the next morning.
Okay. So during the night, you're not moving or repositioning?
No.
Okay. Have you had any episodes since Monday that you've been in your bed and you needed support to turn or sit up?
Well, I pretty much don't do any of that moving. Now, once I'm in bed, somebody has to bring me like something to drink,
Okay.
and they'll hold it to where I can sip through the straw.
Okay. Okay. Tell me how, since Monday, how have you gotten in and out of your bed?
My personal care attendant has had to get me in and out.
Okay. Can you describe the steps?
Yeah, pretty much. When he gets here in the morning, he'll bring me a cup of coffee, and I'll drink that.
Mm-hmm.
And at that point, he will change my urological collection system from a bedside bag to a leg bag, which is strapped onto my leg. So he'll do that. If my colostomy needs to be changed, he'll do that. Then he will dress me. That's putting on my pants and shirt and everything like that. And then bring in my wheelchair next to the bed,
Okay.
and then transfer me from the bed to the wheelchair. Then at that point, he has to get me adjusted where I'm comfortable in the wheelchair. Then at that point, we can go to the bathroom and, brush my teeth or, shave, whatever I need to do. He'll do all that, and after that, I'm pretty much ready for the
You're ready
day.
for the day. Do you have any type of lift device that you've used since Monday to get in and out?
No, I'm lucky I've got a good, strong personal care attendant, and he just transfers me.
Where does he hold you?
He'll lean me up and spin me in the bed to where my legs are off the bed toward the wheelchair, and he will grab around me, lift me, and swivel me over and
Okay.
drop me in a chair.
And try almost, can I say bear hug?
Yeah,
Would
that's
that be
what it is.
appropriate?
That is.
Okay. What do you do when he's doing that?
Just enjoy the ride.
Enjoy the ride. Do you hold on to him or put your arms around
I put
him?
my arms around him.
Okay.
I don't have any hand movement, so I really
Right.
just kind of hang on.
The upper body
Right.
area. Okay, the upper arm area.
Right.
Okay. Are you able to support your upper body by doing that?
I can hang on.
Okay. Okay. Is that what's happened Monday, Tuesday, Wednesday?
Every day.
Morning and night.
And then it's just a reverse procedure at night.
Okay.
Before he goes off, work, we'll pull up next to the bed.
Mm-hmm.
He will transfer me to the bed,
Mm-hmm.
undress me,
Mm-hmm.
and get me set up for the night.
Mm-hmm. Mm-hmm. Now, you mentioned the first thing you do is have coffee.
Yeah.
Now, to have coffee, does Blake help you maneuver yourself while you're in your bed to be able to drink your coffee?
Sometimes I'll drink it before I get in the chair, sometimes afterwards.
Drink it. What'd you do this morning?
This morning, he got here and gave me a shower.
Okay.
So on the days I take a shower, I have a roll-in shower. First, he'll transfer me to what I call a shower chair. So I sit in it and have nothing on at that point. He'll roll me into the shower and gives me a shower. And after the shower, we go back to the bed. He'll transfer me into the bed and at that point get me dressed.
Get you dressed.
And that's then in the wheelchair and all.
Okay. So in your shower this morning, who washes? Does Blake wash?
Yeah, he does everything.
Head
Washes
to
me.
toe?
Head to toe.
Okay.
Yeah.
What is your participation during a shower?
Conversation. That's
Conversation.
About it. Yeah.
Okay.
That's
okay.
pretty
Very
much
good.
it.
Has each episode in the last week followed suit? It's been the same for
Yeah,
your shower. Okay.
Pretty much the same.
Okay. Did you have coffee in bed yesterday?
Actually, I got my wheelchair first.
Okay. Monday, coffee in bed?
I'd say 3 out of 4 times I get in the wheelchair before I have coffee.
Okay. Okay. Very good. I just wanted to make sure
Oh, yeah.
what you were doing in your bed.
Right.
So we did talk about dressing. From the waist up, how do you get dressed? Since Monday, how have you gotten dressed?
Well, usually I will get into my chair without my shirt on, my pants
Okay.
and everything be on. Because once I'm in my chair, it's easy to lean me forward and slip a shirt on. So I
Okay.
usually don't put a shirt on until after I get in the chair.
You're in your chair. Okay.
Right.
What are you doing with your arms when the shirt's getting
Just
on?
try to help him all I can.
You help him.
Can't do much, but
Okay. And has Blake buttoned your buttons?
yeah, he has to do all that.
Okay. So Monday, Tuesday, Wednesday, this morning, you've lifted your arms while he's put the shirt on.
Exactly.
He's buttoned the buttons. What about adjusting the shirt and pulling it down?
He has to do all that.
He does that.
Yeah, and the main thing he looks for is make sure there's no wrinkles that would cause a pressure sore. Because since I can't feel it, if there's a bad wrinkle or something, it's amazing how quick things develop.
Right.
So he makes sure I don't have any binding situations.
Okay. To lean forward to pull the shirt down and adjust it. Can you do that?
Well,
or is Blake?
Most of the time he'll get me going and I kind of hold what I got.
Okay. Does he support your weight as he's adjusting your
Yeah.
shirt? Now you're from the waist down. You're still in your bed.
Right.
How about undergarments? How are those put on?
He has to do all that. And he has to roll
Okay.
me side to side.
Okay.
And kind of pull my pants up as they go. So,
Okay.
it takes training, but he's done it for 13
There's a
years.
system at this point.
Yeah, right.
Are you able to lift your legs, or is
No.
Blake lifting your legs?
He has to do all that.
He's lifting your legs. Whenever you're rolling side to side, are you supporting or helping roll?
No, he has to do all that.
He's rolling. Okay. And feet. Do you wear socks, shoes?
I've got little boots that I wear that are
They're very soft,
Yeah,
huh?
right. If I wear shoes all the time,
Yeah.
I'll get sores and blisters.
Okay.
And since I can't feel them, I don't know if I'm getting them or not.
Right. You have no warning.
Right.
So how do those get on your feet?
He has to put all those on.
Puts them
Yeah.
on for you. Okay. And that's what you've done each time you've gotten dressed and undressed since Monday.
Yep, he does that.
Okay. Very good. Now I do see that you maneuver your chair on your own. Since Monday, is that what you've done each time you've, I'm going to say, ambulated in your
Right.
chair?
Yes.
Have you had any episodes of support in any way? Supervision, setup help, hands-on help?
Well, now another thing Blake has to do is, unplug the chair and get it ready, and then at night, when he gets me out of it, he has to put it back, the charger together,
Okay.
to make sure it's charged and all. But
Okay.
I can pretty much move the joystick,
Okay.
and do that, but,
So you've ambulated through your home
Right.
independently.
Right.
Have you gone outside in the sunshine since Monday?
right, I've got a little, I can automatically open the door, so
Oh, I see. I see the different things at the top
Right.
of the door.
I can open the door, and go outside and,
Mhm.
sit in the sun or roll around or whatever.
Okay.
And then, come back in and
Okay.
open the door.
Since Monday, have you had any help with moving around in your chair outside in the sunshine?
I get stuck sometimes.
Have you gotten stuck?
I haven't got stuck in the last week, but a lot of times,
Well, that's good.
if I get in the grass,
Well, it's been dry too.
right, right.
Mhm.
I have been known to get stuck in a hole or where the driveway turns into the grass. Like
Yes.
I
There's
and
that
then
dip.
at that point, Blake has to come get me out.
Okay. You've mentioned that Blake does help you tend to your catheter and your ostomy whenever the bag's being changed or you're managing either device. Since Monday, have you had any participation in that?
No, I really can't do any of that, so he has
Okay.
to do it.
Each episode, each time it's been done, it's totally been
Totally
done
him.
by Blake.
Uh-huh.
Okay. And we did mention your grooming. Since Monday, what have you done for your grooming? How does that go again?
He has to brush my teeth, and that's putting the toothpaste on, brushing my teeth. I've got a little thing I spit into, and then he'll get like mouthwash, and I'll do that. So he has to manage all that for me.
Okay. Have you shaved since Monday?
Yes.
Yes.
Shave this morning,
Shaved this morning?
and he has to do all that also.
Blake shaves. Okay. Whenever you're doing your grooming routine in the morning and in the evening, since Monday, do you wash your face?
He will.
Blake will.
Yeah.
Okay. Okay. Any other grooming activities you've done?
If I need my toenails cut or fingernails, he
Okay.
has to do all that.
He's taking care of that. What about
Yeah.
combing your hair each day?
Not much hair to comb.
Not much
but-
hair to comb,
No.
huh? Okay. So since Monday, for brushing your teeth using mouthwash on Monday, Tuesday, Wednesday, Blake has done that for you.
Yes.
And when he's doing that, are you participating? Are you holding anything, setting up, or
Not really. He pretty much
he's doing it
does
for
all,
you?
Yeah.
Okay. And the one episode of shaving, he shaved you.
Yes.
He did a good job. I don't see any
He did-
nicks.
well, I don't know. He does a good job. Yeah.
Very good. So today we're in August, okay?
Okay.
If you compare today, August 6th, 5th, what day is it?
6th, I think.
6th. Let's compare August 6th to what you were doing May 6th. As far as dressing, bathing, transpiring. Has there been any change when you compare those 2 days?
Not really.
Okay.
That's a standard day.
Okay. Okay. Very good. And you move around primarily in your electric wheelchair.
Mhm.
All right. Since Monday, have you gone up and down steps? or stairs?
Not unless there's a ramp. Like if I go to a doctor's office in a high-rise building, I'll go into the elevator, and go up.
And go up.
But most elevators, I have a hard time reaching buttons, so Blake has to
He'll
go
do
with
that
me
for
and
you.
everything.
Okay. Have y'all done that since Monday?
No,
No. So no elevators, no stairs since Monday?
no.
Okay. In a typical week, in the last, let's say, month, in a typical week, how many days do you go outside in the sunshine, in the elements? Past the porch?
I'd say probably 4 days a week.
4 days a week?
Yeah.
Oh,
I
that's
try
how
to-
you got some tan there,
Yeah,
huh?
try to get out and, go somewhere.
Okay. So tell me, since Monday, as far as your activity, we've talked in a lot of detail about the moving around, the showering, the getting dressed. Have you had physical activity more than 2 hours since Monday? Have you been physically active, whether it be during your shower, dressing? More than 2 hours of physical activity or less?
You mean by physical activity like going somewhere or?
No,
or-
just any type of, in the process of showering, dressing, moving around in your bed, just moving your arms.
Once I get up, I spend a lot of time like on the computer. And I don't know if you'd call that physical or not, but like, Facebook or just social media and stuff, or emails and things like that. Actually, in the process of starting, I'm thinking about writing a book. So,
I would
I'll
buy
spend
it.
time on that, getting that source and stuff together. So that's pretty much it.
Okay. So, and you go outside 4 days a week in the process of dressing, you're moving your upper body. It sounds like you probably get a couple hours in each day
Yeah.
of physical movement and
I
physical
do.
activity. So when I look at the last 3 days you've had.
Yeah, and if the grandkids are over here,
yeah.
we'll play hide and seek or we'll, do something. So
Right, right.
they're a lot of fun. I do a lot of things with them.
Right. So you get plenty of upper body movement.
Right. Yeah.
Okay. Very good. At this point in time, do you feel that there's any capability of increasing your functional independence?
It would all be technologically advanced
Technologically.
because physically, after 22, 23 years, I'm not going to get any more ability to physically do things.
The assessor needs to be sensitive when discussing continence items to receive accurate information over the last 7 days.
In the last 7 days, has your catheter or colostomy leaked?
No, but it's not uncommon for it to.
Okay, it
So,
does happen.
Yeah, if I'm in a wheelchair and the catheter's disconnected or stops up or whatever, and I urinate all over myself, my personal care attendant at that point would have to, take me out of the chair, put me in bed, clean me up, and do all that.
All that
It
routine.
hadn't happened in the last week, but
Okay.
occasionally it does.
If it is something that you're aware of and you look for.
Yes.
If I compare May 4th and your continence to today, has there been a change?
No.
When coding this item, the use of restraints must be coded regardless of the intent of the restraint.
So, Mr. Jan, I see that you have this chest strap and you have a seatbelt,
Right.
and your feet are also strapped down.
Right.
Can you tell me about that?
Yeah, it's when you get assessed for a wheelchair, they come in and kind of make sure everything fits, and you know how high your arms ought to be and how low your feet ought to be, and you know what you're able to do. So when I was assessed for the wheelchair, of course you got to have a seat belt just to make sure you stay in, don't go flying out. But like for the chest strap, if I'm going forward and were to stop in a hurry or take a corner, and I would fall forward and I couldn't get myself back up. So the chest strap is designed to kind of a safety to keep me in place. Plus, physically, it would be so hard to always keep my body up.
Your shoulders
So
back.
they do an assessment along with the therapist to make sure you're, you know, safe in the wheelchair and that it's the, you know, best for you. And so the chest strap is to keep my back in place and keep me from falling forward and getting stuck. Now on my feet, I have a strap that keeps my feet pointing forward and where they should be. I can't feel my feet, obviously, so if my foot were to fall off the support, I could actually run over my foot or run into something or all kinds of problems. So it keeps my feet pointing in the right direction and safely where they should be. The chest strap keeps me positioned in the wheelchair, and the seat belts just for safety. So it made me a lot more comfortable and feel a lot more secure.
Okay. So, and you had said a therapist and the wheelchair assessor both modeled this for your needs.
Right.
And earlier we talked about you do make your own decisions and you are able to communicate your needs. So in this case, these straps, it enables you to stay safe and comfortable in your chair.
Exactly. They're a big benefit, and really wouldn't be safe without them.
Okay. Okay. And when we were talking about bed mobility and getting in and out of bed and transferring in and out of bed, you mentioned that you do have the rails on your
Bed
hospital
rails.
bed. Do you use those?
Yeah, they come on and off.
Okay.
And like when I'm being transferred in or out of the bed, we take the rails off. And then when I'm in bed, the rails go back on. It's really a safety, factor. And I was having troubles with I would spasm in the middle of the night, and my leg would flop off the bed, which again would cause a pressure situation where I can get a sore.
Right.
So the rails at the foot of my bed and on the side of my bed help me. It's just safety to make sure that, I don't flip out of bed or whatever.
Okay.
So they make me feel better. I'm a lot more secure with those.
Okay.
And if somebody comes in, they could pull them right off.
Do you have access to someone at night to lower them if you
My
needed?
wife, yeah.
Okay. And so that sounds, from what you're describing, it does sound like that also enables you to be safe and comfortable considering the spasms.
Exactly. And I feel better, with them there.
With them up. Okay.
Right.
Okay.
Assessors need to be familiar with skin conditions and the intent of each item. This section captures a variety of skin conditions, wounds, and skin ulceration, and each item has a specific intent. When interviewing a participant, an assessor must ask enough probing questions to ensure the intent of each item is captured and appropriately coded.
Your skin right now, from head to toe, on the surface of your skin, do you have any rashes, burns,
No rashes or
itchy
burns.
spots?
I've got a couple of pressure sores.
Okay, tell me about those.
Okay, I've got actually 2 on my bottom, and I've had one of them for about a year. It takes forever to heal.
Yes.
With pressure sores.
Yes.
But The pressure source I have, home health comes by once a week just to check on it and make sure it's okay and everything.
Okay.
And that's really the only, and then on my toe, I've got a little pressure sore that I'm taking care of.
What stages are they at this point?
All right, today the one of the pressure sores on my bottom is a stage 4,
Okay.
but almost a 3. It's starting to improve, and then the other one's just a 1.
Okay. And the area on your toe?
It's more or less a blister.
It's
and
a blister.
Yeah, it's a pressure sore. It hadn't been diagnosed as such.
Not yet. Is it relatively new?
Yes.
Okay. Will you be showing it to your doctor?
Yeah, in fact, he's already seen it. And just
Okay.
kind of give me advice on what to do with it.
Okay. Very, very good. So home health, she's coming once a week. She is
Right.
coming once a week. What is she doing for the wound? What type of treatment?
She, of course, does a total assessment, the blood pressure, checks my blood sugar, looks at the wound, changes the wound dressing,
Okay.
and, just keeps track of it.
Okay. Are there any type of creams or ointments that are being applied to the wound?
Yes. Now those, over the last year while it's been treated, have changed. We'll try one thing and then I'll go back and see the doctor and he'll say, well, let's try this. So, yeah.
Okay. So in the last week, in the last 7 days, you've had the dressing and the ointment applied.
Right.
Okay. Very good. What about any type of other type of wound care, pressure relieving devices?
Well, my wheelchair tilts, and I guess, let me show you it. Like every hour or so, I will like tilt back just to relieve pressure.
Pressure in that place. So you're doing that every hour?
Yeah, supposed to. I can't say I do it every hour. I'm supposed to do it every hour.
Okay.
If I get busy, sometimes I'll forget about it, but
Right.
I do that, and that's pretty much it.
Okay.
And then at night when I go to bed, I've got a little mattress that, it moves me around, so
Okay.
that's helping.
That is helping. So we did talk about the pressure ulcer that you currently have. What about any stasis ulcers on your legs?
No,
No. Okay. On your feet, I know you do have that blister that is
Right.
a early pressure ulcer. Any corns or calluses
no,
that would need treatment?
No.
And just to be sure we're on the same page, you told me you don't have any burns right now.
no,
Open lesions
no,
other than the pressure ulcer?
no,
Okay. Skin tears, any abrasions or cuts?
no, not at this time.
Okay. And surgical wounds that are being treated now?
No.
No. Okay.
The assessor needs to probe and ask additional questions in order to capture the true picture.
To me, it's, for an interviewer, it's critical to know, to break it down into little bites as much as you can. No doubt about it. Same way with when we talked about finances. If you were asked a question, do you handle your own finances? Well, I'd like to say yes, because I direct where the money goes and everything. But as far as the overall concept of handling my finances, I have to have somebody write out the checks, go to the ATM, put papers in front of me to see, put a pen on my hand so I can, write. So without asking all those probing questions, it's hard to get a true picture. A lot of times statements or questions are so broad that unless you dig into them, you really don't get the true picture.
This concludes an MDS-HC assessment completed by a certified assessor using open-ended interviewing techniques. The assessor asked questions that built on the participants' responses to ensure accurate coding. These skills are important to be able to code accurately and be consistent in coding MDS-HC assessments.